Hi, many people suffer from frozen shoulder, which simply means adhesive capsulitis. So the underlying pathology is thickness of the tissue, which then causes a lot of tightness and limitation in ranging the shoulder. Although it is more common in females, male can get this problem too, and it is often associated with diabetes. Now, the reason for developing frozen shoulder is multifactorial. It may be after some degree of disuse of the shoulder due to an injury resulting in tendinitis of the shoulder or a clavicle fracture, or whenever there is some reason for not moving the shoulder for some duration of time, and this then leads on to secondary onset or stiffness. Typically, an individual may find that it is difficult for him or her to reach for the back. They may also find it challenging to reach for certain objects which are placed on a higher platform. And this is when they first realize that they have got some degree of limitation in the shoulder. It can also present with some degree of pain depending on the stage of the frozen shoulder, and pain typically happens around the shoulder, which can radiate down to the upper arm, and is also associated with moving the shoulder joint. It's important to get an early diagnosis with an X-ray, and often an MRI scan may be advised to rule out if there is any underlying shoulder pathology. Treatment basically consists of physiotherapy, the use of anti-inflammatory medications. Rarely, if the pain is significant, a steroid injection may be used, and of course, if after months or years of doing physio and the condition is not getting better, then you may be advised on some surgical options to restore the mobility and function of the shoulder. Therefore, whenever you have pain associated with limited range of motion, get an early diagnosis, treat the underlying problem effectively, and if there is any evidence of frozen shoulder based on clinical examination and radiological investigations, then you have to start physiotherapy, and very importantly, you have to be consistent with the physiotherapy exercises. It can sometimes take months or even years to regain full range of motion. Therefore, injury prevention is important, and of course, an early diagnosis is of paramount importance. Take care.